Just a quick one. Ageing population. Bed blocking. I'm sure that the conversation you had around the table today was to how to release some of the folks who are actually in hospital and need to be moved on. What are your plans to try and alleviate that?
Yeah, I will speak advisedly because there is always an awful lot of mythology that grows up, and I know it's been in the news over the last few days and on Radio Solent and others. So I would it's really helpful to test, slay some myths. So I suspect if I said what number of you heard of the number of
153.
153. 4 wards. 4 wards. So the danger is that becomes a mythology that there are 153 people sat there just waiting to leave the hospital. And of course that's entirely inaccurate, and is a very, very dangerous presumption to make. And if you bear with me, I'll just give you a breakdown of how that plays. Imagine we have 160 people in any hospital setting. So of course hospitals are there's treatment and then rehabilitation, and on any given day there will be about, say, it's one at Portsmouth Hospital, which is a bed base of just under 1,000. There'll be about 30 people who have complex needs who will leave from the hospital. That makes sense. So the morning you wake up at 10 o'clock, you have your integrated discharge meeting, and 30 people will be leaving the hospital today. So of the 160 that are on that list, you say, right, 30 are going to be leaving today. So they're not really, but they just happen to have breakfast and they're going out the door. So it's probably unreasonable to say that they are blocking a bed. They're literally getting out of their bed and going down. So that's 30 that aren't reasonably out of bed. Then do you think, well, on any given day, typically, once the morning ward rounds have happened, there's about 30 people who say, right, we think you're now ready to leave the hospital, but you have a bit of an assessment and before you can go. So it's 30 people coming on literally that morning, that minute. And again, it's probably unreasonable to think that the second that somebody who has got complex needs is identified as ready, is no longer medically fit, leaves the hospital exactly that minute. There's about 24 hours of where you need to make sure that they can go home to the right place, there's a carer there, we might need some adaptations. So 30 going out that day and 30 literally coming on that minute. Does that make sense? So suddenly I'm from 160 people, I'm down to 100 because I've got 30 going out and I've got 30 literally identified that day. So then I've got, so of that 100, how many people are really now, to use a really ugly expression, blocking beds? So when someone's identified as, right, you're now clinically stable, so you're out of, you've received the treatment or you've received, we now think that you've received all the medical care you need. There's a period called assessment, and it usually runs about 24 to 48 hours where the individual will have a conversation, the relatives might be talked about, where's the right place for that person to be cared for, you might need some physiotherapy, you might need occupational therapy to determine whether you're safe and appropriate to go home. And that's actually a totally reasonable period of time. If it's within 24 hours, 48 hours conversation with the relatives and family, that takes about 24, 48 hours. Around 70 people are within that 24, 48 hour loop of conversation. Still waiting for physiotherapists to come down, waiting for the medicine for other people to come and just do a final assessment to make sure everything's done. So that's 70 of the 100. So all I'm left with now is 30 people in hospital.